Welcome back to Pet Parent Veterinary Learning. Hello, Harrison. What pet parent question do we have today?
Well, Stephen, Nick actually sent us a bone mail. Nick's a 2-year-old male neutered beagle who wants to know why he's always called Chunky Monkey.
Huh. Well, that's not very friendly to be called a chunky monkey. Sorry about that, Nick. Let's just say pleasantly plump for now. And there are many, many reasons for weight gain in dogs. And since Nick is only 2 years old, very young adult, let's discuss his eating and nutritional habits. First, being a pet parent, you need to be concerned as future medical conditions can occur later in Nick's life. Veterinarians use a body condition score. Here's an acronym for you, BCS, body condition score, to evaluate a dog's weight. The preferred scale ranges from 1 being very emaciated to 9 being very obese. And we'll get to where you are a little later in the segment, with an ideal body score of 5. So that's what we're shooting for. Weight changes can have many causes, including dietary changes, feeding habits, physical activity, age, and medication, as well as underlying disease processes. According to the body condition score, you can see you should be sitting at a 5. And I would say right now, Nick, you're probably looking at a 9. You are pleasantly plump. So, Nick, here are 5 steps to get started for your pet parent. Tell your mom and your dad. Schedule a visit with your veterinarian so they can really do the body score correctly. Do a complete physical exam. It's always good to get that done. And have a discussion about nutrition, your current diet and feeding habits. Do you eat once a day? Do you eat twice a day? Do you eat your sister or your brother's food? Have your veterinarian prescribe a diet plan and pet food that will promote weight loss, but, however, keep you very, very full. That's important. And keep all garbage cans sealed. Close the refrigerator doors. Make sure to tell your pet parent, I know you don't want to. And like I said before, if you have a brother or sister, you want to feed them separately because I know you might be nibbling into their plate. No more begging for snacks and treats outside of eating time.
Now, the 5 biggest questions you must ask yourself about pet obesity are: 1. Is my pet overweight? 2. How many calories should I feed my pet each day? 3. How much weight should my pet lose in a month? 4. What kinds of exercise should my pet do? And 5. Is my pet at risk for a medical problem due to excessive weight? Stephen?
These are all great questions, Harrison. However, I'm jumping straight to number 5 because this is where I see the most of. Is my pet at risk for a medical problem due to excess weight? This is a very serious question that you need to understand for your pet's future. Dogs with excess fat are at greater risk for developing like diabetes, arthritis, high blood pressure, kidney disease, and many forms of cancer. The few minutes you spend on diet and weight could be the difference between 2 additional years or more of high quality life or a shortened, suffering final stage of life. Harrison, where can I learn more about pet obesity?
Well, first off, your veterinarian is 100% first on the list for the best advice and recommendations. But to learn more, you can go to petobesityprevention.org/pet-weight-check. Now, if you guys enjoyed this, make sure you subscribe to our channel. Thank you guys so much for watching, and make sure you join us next week as Margaret sent us a mouse mail. They are a 4-year-old Cornish Rex scheduled for a dental cleaning, and her mom is really worried.